Thank you all for joining us again and for our partner in today's Lunch and Learn, Allegheny Health Network. And thank you to Dr. Javed for joining us today to speak about colorectal cancer. Dr. Javed is a gastroenterologist at Allegheny Health Network in Grove City and Erie. He knows no two patients are the same and makes an effort to always treat his patients like his family by providing customized and individualized care when it comes to more complex cases that require a multidisciplinary approach. He believes a collaborative effort with colleagues of different specialties helps to optimize patient outcomes. And outside of the office, you can find him hiking, baking, and reading to his almost 2-year-old son. So thank you so much for joining us today and speaking with us about colorectal cancer and what we can do to avoid our risk.
Thank you, Donna. Thank you so much for having me. It's such a pleasure being here today. Hi, everybody. This is Javed. Very nice to meet everybody. We can start. Let's see. All right. So I would want to start with the very basics and start by chatting about what colorectal cancer really is. Colorectal cancer, also known as colon cancer in more common vernacular, is a cancer of the colon and the rectum, and occurs when the growth in the lining of your colon and rectum becomes cancerous. The colon is a vital organ in our body, in our digestive system. The rectum is the very end of the colon. And the colon and rectum, known as the large intestine, is a large, long, thick tube that takes away water and minerals from undigested food and stores undigested and fecal material. Most colorectal cancers come from precancerous polyps, as we like to call them adenomatous or serrated polyps. These polyps form over a number of years, like 5 to 10 years, especially if they are left untreated or unresected. A polyp is basically a mushroom-like or flat growth inside the wall of our colons and rectums, and polyps grow very slowly over the course of years. Not all colorectal polyps have the same risk of turning into colon cancers. And precancerous polyps could become cancerous. Some other types of polyps, like inflammatory or hyperplastic polyps, do not. So the type of polyps drives the risk of transformation into colorectal cancer. My emphasis on this etiology or pathophysiology is because I want to plug it in that removing these precancerous polyps before they turn into cancers prevents colorectal cancers. And even if they are transformed into cancerous lesions, if they're caught early enough, just surgery or just resection of that lesion can actually cure your colorectal cancer. So finding these polyps and finding these polyps turning into cancers early is the key here, because that is what improves treatment outcomes and survival rates. Now, who gets colorectal cancer? As of 2020, colorectal cancer is the third most common cause of cancer in both men and women. It is the second leading cause of cancer deaths in the United States. While men and women have the same lifetime risk for colorectal cancer, men are actually at higher risk than women at any given age. Black individuals are at higher risk for developing colorectal cancers. Native Americans are more likely to be diagnosed with colorectal cancers. Colon and rectal polyps occur at any age, but they are most common after the age of 45. Colorectal cancers are highest in adults over the age of 50. However, since the 1990s, this colorectal cancer rate has increased in people under the age of 50 as well. Hence, the screening age now starting at 45. So you may be at a normal or greater risk for colorectal cancers based on your age, your race, your personal and family history of having colorectal cancers or premalignant polyps. You would be considered higher risk if, number one, you've had colorectal cancers or have had precancerous polyps. If you've had one or more parent, brother, sister, or child who's had these polyps or colorectal cancer. If you have family members with other cancers, for example, cancers in the uterus or cancers in the ovary and some other organs. If you identify as Black American or African American patient. If you have a history of inflammatory bowel disease, which is an umbrella term that covers both Crohn's disease and ulcerative colitis. Or if you have a hereditary polyp syndrome, for example, a syndrome called FAP, which is familial adenomatous polyp syndrome, where very young people start to develop dozens and then hundreds of polyps in their colon very early in their lives. What are some of the symptoms of colorectal cancers? So colorectal cancer does not cause symptoms early on, which is why, again, screening colonoscopies are so important. As colorectal cancer progresses, there are a number of symptoms that patients can develop, which are basically warning signs, including rectal bleeding, blood in your stools. It can either be bright red blood, blood coating your otherwise brown stool, or black colored stools. And altered bowel habits, for example, having some frequency or urgency, or the caliber of your stool becoming thin, pencil-like. If you start having pain, especially in the lower abdomen, while or after or before having bowel movements, frequent cramping, frequent gas pains, and unintentional weight loss. So now you ask, I feel fine, I have none of these symptoms. Why can't I wait for these symptoms to develop rather than have a colonoscopy earlier on when I'm so healthy? And I would answer that by saying that colon cancer screening earlier on will save your life. Precancerous polyps often do not cause any symptoms, and removing them will end up saving your life by preventing colorectal cancers. Early colorectal cancer also does not have any symptoms. So even if your polyp already has transformed into a cancerous lesion, taking it out early is also going to be supremely beneficial. I also do want to signify that colorectal cancers found in people without symptoms are often not as advanced as when you have symptoms. So all the more reason to get evaluated or get screened while you are symptom-free. Detection of colorectal cancers at an early stage will increase your survival rate. It will increase the treatment options that are available, and hence it will make the process of treatment and making a plan for you much more easier for both the patient and the physician, if needed. I'll give you some numbers. The 5-year survival rate for patients who have their colon cancers detected early on is more than 90%. Unfortunately, only about 39% of all colorectal cancers come to us this early. So one of the reasons why this education is so important is, as physicians, our goal is for patients to get screened early on so that we start to get more and more people to be seen sooner if they do need our care. The American College of Gastroenterology, the American Gastroenterology Association, they have now a consensus that colorectal cancer in average risk patient should start at the age of 45 and should continue until the age of 75. This reduces precancerous growths, this reduces colorectal cancer, and reduces death from colorectal cancers as well. So very important, 45 is the new 50. The next time you see your primary care provider or gastroenterologist, please do bring these questions in your mind or written on a piece of paper. Ask them what my colorectal cancer screening test options are, given my personal history, my family history. Talk about these options, the risks and benefits of these options. Talk about what happens if the doctor does find a polyp. How do I get ready for my test, which is a colonoscopy or the other option that we'll talk about in a bit. If a polyp is found, how frequently do I need to get tested again? And how often do you need to do a standard colonoscopy after doing a different test first? All of these are very valid questions and often life-saving ones. Now, we'll briefly talk about what screening options are available to patients to start colorectal cancer screening. Let's start with the gold standard, which is a one-step screening, that is colonoscopy. You know, colonoscopy is a fantastic, as I mentioned earlier, gold standard one-step test that looks for growths, which are the polyps, in your entire colon and the rectum using what we call a colonoscope. What makes it so superior of a test is that your doctor can both detect and remove these polyps during your colonoscopy and hence prevent colorectal cancers. It is the most common GI procedure which is being done and offered in the US. And I won't stop saying colonoscopy with removal of polyps offers an excellent long-term protection against developing colorectal cancer and dying from it. So this is a life-saving procedure. We'll briefly talk about some two-step procedures or tests. For example, stool-based tests. These tests detect blood or altered DNA in the stool as a first step. And then if you have a positive test, eventually you will have to have a colonoscopy for further examination. Your doctor might bring up what we call a FIT test, which is an acronym for fecal immunochemical test. This detects hidden blood in the stool. The stool FIT test is typically performed as an annual test, and a positive test, as I mentioned earlier, will eventually require a colonoscopy. Another modality that is now becoming, more in vogue is a multi-target stool DNA test, which in common vernacular you might have heard of Cologuard. Multi-target stool DNA test is also a non-invasive screening test. It looks for abnormal DNA, which is being shed off by this polyp that is in your colon. This is definitely more sensitive than the FIT test, but your chances of getting a false positive may increase with advancing age. In addition, there's also a significant chance of a false negative, which means even if the test comes back negative, there is still a sizable chance that you have polyps hiding in there. If your Cologuard test or the multi-target stool DNA test comes back positive, of course, you will end up getting a colonoscopy, and that will be the next recommendation. Tests for individuals who cannot or will not have a colonoscopy, or for some reason cannot have the non-invasive tests, include things like a certain CT scan called a CT colonography. This is usually done after a bowel prep, and in rare circumstances, a capsule endoscopy, which is a pill cam, can be done as well, none of which are gold standard tests. The incidence of colorectal cancers is also rising in younger patients. Fortunately, though, colorectal cancer is being found earlier as well and is becoming easier to cure. Over the course of years, the treatment options available for colorectal cancers have also been revolutionized. So we are seeing better outcomes in terms of survival. There are approximately 1.2 million colorectal cancer survivors in the US right now, and the number is growing. A lot of that is because colorectal cancers are now being screened at an earlier age as well. One of the things that I thought was relevant is we can't take a colonoscopy out of the context that we live in. The times that we live in, it is important to talk about, the pandemic, the global pandemic that has affected a lot of our community residents. And I do want to assure everybody that it is very important for each one of you to take control of your health during this pandemic. Colorectal cancer screening is safe and extremely important and should not wait. And we, as gastroenterologists, have, as a community, as healthcare providers, and as carers, strongly advise to not put off preventive health screenings during this time. Along with getting tested regularly, healthy lifestyle choices are always recommended by physicians as a way to decrease your cancer risk in general. Here is how you can help decrease your risk. Do not smoke or use tobacco products. Eating higher fibers like whole grains and vegetables. There is some data showing that that decreases the chance of developing polyps and eventually colorectal cancers. Eating less fats, butters, red meats has been shown to improve your risk. Getting active, decreasing your processed food intake, and keeping your weight in a healthy range are always, always good lifestyle choices. That by no means takes place of colorectal cancer screening. Finally, coming to an end for our talk, Allegheny Health Network, the mandatory plug-in, provides diagnostic and therapeutic services at many of our hospitals in your region. Our division of gastroenterology, hepatology, and nutrition physicians are nationally recognized in their work, and this means that you will be cared for by physicians who are known for their expertise and specialize in your specific healthcare concerns. Call us to schedule your colorectal cancer screening. It's highly important, as I mentioned earlier. And with this, we come to an end of our presentation today. I would love to chat more and take any questions. Thank you so much.
Thank you so much, Doctor, for all the information that you provided today. I'm going to have Jess go ahead and start recording.